common, so we all treat it.
Yeah.
No, it's still not my top favorite, but it's one of my favorites.
Okay, I was just joking, but no, I appreciate that. I mean, it's in your expertise, which is what what really helps us a lot. So as you may have heard, Al Roker, which is one of the I think the weather, he leads the weather news for the Today Show. Are you familiar with who he is?
Not really. I'm sorry.
It's okay. So he's pretty much a well-known host in the United States, in the world, and in the United States, he's part of the Today Show, and he just announced that he was diagnosed with prostate cancer. In fact, I think the announcement came out today or yesterday. It's very, very recent news. And that's why we want to ask you about it, because we might have media interested now that there's a celebrity, right, that got this. So that's why I'm bringing up Al Roker is his name. So Al Roker's detection of prostate cancer began with a routine physical when his doctor noticed an elevated prostate-specific antigen, known as PSA.
Yes.
In his blood work. We have some questions regarding this test, regarding the PSA. So is this test part of routine blood work for all men? And if so, what are the specifics regarding this test, and who should have this test done?
So PSA test is a screening test that's recommended for all men above the age of 50 to have it once a year by their primary care physicians. People who have family history of prostate cancer should have it earlier. African Americans, because African Americans tend to have at a higher risk of having aggressive prostate cancer, they should have it earlier at the age of 45 or so. That test is done once a year. And the test, the normal value of it is the line in the sand is 4. But if you have someone who is, let's say, 45 and have a PSA of 3.6, that may be high enough to trigger a biopsy, because the normal value of PSA is not just one number, 4, and that's it. No, the older people get, the higher the PSA is. So maybe a 75-year-old has a PSA of 6 and very large prostate, then I wouldn't worry too much about it. But a young person with a PSA of 3 and a small prostate, then I would worry about it. So PSA is not, even it's called prostate-specific antigen, it's not really specific for cancer. Large prostate would cause a high PSA. Infection of the bladder, retention of urine will cause high PSA. Instrumentation like a Foley or a biopsy can cause elevated PSA. Intercourse ejaculation will cause transient rise in PSA. But consistent rise in elevated PSA is definitely a trigger for a biopsy.
Okay.
Can I jump in? Hey.
Yes.
I know
it's a lot of information. I'm sorry.
No. We've written about the PSA. I have for our blog over the last few years because of its the debate over its false positives, which you just went over. And I guess what we say is consult with your physician, and make the most important. I guess the starting point is the physical exam. And then the PSA can be another point of reference, but not to rely entirely on, of course.
Correct.
Is that your? I mean, I know there's this controversy over the PSA, but are you comfortable with the PSA as an additional tool, I guess, or a screening?
The PSA is definitely a useful tool, but we just have to keep in mind it's not a perfect tool.
Right.
And one PSA is not enough. So the standard of care, the guidelines, is not to intervene with just one single PSA. So at least 2 PSAs to prove that there is elevated PSA that's consistent that when we intervene.
Okay.
And again, it's not the only tool. And now we have the multiparametric MRI. So an elevated PSA could trigger an MRI, which occasionally can detect the cancer. So this is a much more useful tool than the PSA alone. But usually the PSA is the first step.
Right. And I think unnecessary biopsies may have been one of the reasons why, it's controversial, the false positives leading to biopsies. That test you just mentioned, is that being increased? Is that available now at the MCI or?
It's available at MCI. Yes, correct.
Right. Excellent. Did you want to continue, Papsi, on your question?
Yes.
Or please. I'm sorry.
Okay. And then I think, no, totally fine. That's why you're here, John. Well, and then I think just to clarify, you did say that the PSA was part of routine blood work for all men, right?
Correct, yes.
Yes.
Above the age of 50, yes.
Above the age of 50, okay.
I can verify that.
So if this test is not usually ordered, when should it be requested? But I think then this question doesn't apply anymore because you're saying it is routine.
Correct, yes. It was not a routine at a certain point of time where there was this debate from, I think, family medicine practitioners that PSA could do more harm than good. And they really pushed toward not screening for prostate cancer with PSA test. And that went on for about 3 years. Oops, I think my cat is from
It's so beautiful.
Oh, really?
My
Look
God.
how white he is. Wow.
Aaron, you missed it. I don't know if Aaron's on video, but it was this most beautiful, fluffy, white, looks like a snow lion.
now.
The screen went white.
Yeah.
So pretty.
So I think this went on for about 3 years. And at the end of 3 years, they realized that there are so many patients, they got diagnosed with metastatic prostate cancer. So now they kind of now we are back. Now their recommendation now is to, and instead of clearly everyone should get a PSA test, we should discuss with the physician the benefit of a PSA test, and who needs it should receive it. But we're back to PSA screening again.
Right.
Okay. What are the genetic factors that men should be mindful of regarding prostate cancer?
So, prostate cancer runs in families. So anyone with family history of prostate cancer should start the screening early. And especially if the family history of someone who had someone's father had an aggressive prostate cancer or died from prostate cancer. So this is something anyone should be concerned of, and the screening should start very early, 5 years before the normal screening. And I've seen patients who have done it way early, just out of fear of prostate cancer. African Americans, they tend to have an aggressive disease, so the screening should start early as well. Yeah.
Okay. Are there any clinical trials underway at Miami Cancer Institute focused on treatments for prostate cancer?
There are several clinical trials here at MCI. For treating prostate cancer, yes. I'm not quite sure which ones are here, since I haven't seen many new prostate cancers, so I haven't looked into what are the available trials here right now. But I know Manoharan mentioned to me that there are several clinical trials available.
For prostate?
For prostate, yes.
Okay, so should I follow up with him if I need any details on that?
Yeah, and I can easily look this up too and have it for you and email it to you. What are the current available trials?
Oh, that would be great. Nothing. I mean, you don't have to take too long, but if you can send me, I don't know if you have maybe a paper, a link, or something that we made aware, that would be great. And so I guess so since we do have clinical trials, does the trial represent a diverse patient population? Do you know, or maybe you don't know yet?
And what do you mean, Usually,
And the
like
MCI trials that we have, do you know if they're representative of a diverse patient population?
like if they enroll, let's say, metastatic prostate cancer or a certain race or.
Yeah, I think, well, I think what we mean is by race, like diversity in like blacks, whites, Hispanics, right, Erin? Is that what we're trying to get?
Correct. Yes,
Yeah.
correct.
I will have to look into it, but most of the trial I was involved in, they did not look at the race specifically or enroll a certain race and not the other. It was mainly about the pathology of the disease. Like, let's say there are clinical trials for metastatic, well, not metastatic, like the one trial I was involved in my residency was the docetaxel before surgery in advanced, localized advanced prostate cancer. So patient who had aggressive prostate cancer and it's localized, not metastatic, we gave them docetaxel chemotherapy before the surgery. So we enrolled pretty much all races, like a race was not a factor to enroll or not. It was mainly the disease, the pathology of the disease that decided to enroll this patient or not. I'm not sure if that answers your question or not.
Yeah, no, it's okay. I think if it's okay with you, when you have a chance, at some point, you can send me like confirm that we have a clinical trial for prostate cancer at MCI. That would be great. And if we do, just from my experience, as you know, we have ties to MSK. If we have a clinical trial happening here at MCI, Erin, just so you know, it usually is diverse. That's part of the reason why, just because of the Miami demographic is very diverse in and of itself, and that's part of the reason why MSK was so interested in partnering with us too. In part, was because they wanted to have access to this diverse patient population. So it's almost like if we have a clinical trial, we pretty much know it's diverse.
It will have to be. It will have to be.
Yeah, just because of our patient population in Miami. So
Okay, great.
Yeah, so we can count on that. And I think, even though you don't know the exact trial, did you say, Dr. Elderfari, that you are sure we have a clinical trial, or you're not sure? You need to check back.
I'm pretty sure, and like shortly after the interview, I will send you the trials we have available.
Okay.
It's just because when I first joined, actually before I joined, I just to help me decide if I should join or not, I looked at the available trials here at MCI, and I found, like, to be honest with you, I was more interested in clinical trials for renal cell cancer. So, but I'm pretty sure I found a list of clinical trials for prostate cancer as well.
Okay. All right. Well, like I said, if you just know of one or two, it'd be helpful for us to know that. But that's great. Thank you so much. I think the last thing I want to add here is we wanted to see if MCI has an African American testicular cancer or prostate cancer patient story. As you may know, African American men, not as you may know, you know already, are twice as likely to die from and 50% more likely to get prostate cancer than white men. So that's part of the reason, and moreover, the disease is more likely to impact older African American men. So if possible, it would be great to offer a patient story for the media representing this race, since the media will be covering the disease from this angle. And that's because Al Roker is African American.
Okay. I'll have to ask Manu and see if he would remember a patient of his or Casa about a patient story like that.
Okay.
And do we have to get the patient permission to have his story out there?
Yes. Feel free to ask. I'm happy to also follow up separately. Like you did a great job today. Thank you so much for all of the insights you gave us. If you yourself don't know of a patient like of yours right now or of the practice, I'm happy to also follow up with Dr. Bano and Casso and ask them, because that's separate from the great insights you just shared with us. That's also in addition to what you just shared. We would love to also have like a patient that we could, you know, have a story for. But yeah, if you think of anyone yourself or you're here, please let me know. And yes, the first step would be, usually it should be like a grateful patient. Typically they do better. Patients are like really grateful to you or have had a success story. The first step is asking them, because they're not all, they could be grateful, but they're not always comfortable, right, with sharing. So the first step would be like, would you be open to sharing your story with our marketing team? And if they say yes to you, then say, is it okay if I give your number or email your contact to our marketing department? And if they say yes, then you can just give it to me and I'll take it from there.
Yeah. Well, like, as you know, I'm new here, and most of we have a high volume of bladder cancer. The one patient I diagnosed with prostate cancer, he's actually young, an international patient, came from, I think, I'm not quite sure which country in South America, to be treated here, and I diagnosed him with prostate cancer. He actually had his father had prostate cancer as well. He's young, and he's kind of dark skinned, but Hispanic. I don't know if I would call him African American. So that's the only one patient I have with prostate cancer. But the story hasn't ended yet. Like, I diagnosed him. I'm doing phone scan and a CT scan to detect metastatic disease.
Right.
And if it's not metastatic, he will probably have radical prostatectomy. Right. So that's the only one patient on the top of my head now. But
and it can be a person of color. It doesn't have to be from African America or African American. I should say it could be, like, for example, we profiled a breast cancer patient who was Haitian, so technically I guess she's a woman of color. So anything like that, if it's that profile, would be great. Black is basically what people are looking for.
I will share with you this patient, and he is very grateful. His daughter lives in New Jersey, and she came to Miami to see me with him as well. But again, the only problem I see is that the story hasn't the story is still happening. But I'll ask Dr. Manohar and Casso as well to see if they have a patient they can share with you and me as well.
That would be great, yeah. And typically, like I said, and if we don't have one yet, that's okay. But typically the best patients for this kind of collaboration to help promote the great work we're doing here is a grateful patient. So they don't necessarily have to be at the end of the story, but they're doing well, like, you know, it's going well, they're grateful with what's happening. And then the best type of patient is also obviously a successful patient story, someone we've been able to we've been able to remove the cancer, or they're at a good, they're at a survivorship type of
well, I'm sure Mano will have many patient stories like that. But
and by the way, just out of curiosity, and like I said, I have the privilege to work with you guys a lot with our experts, and I learn with you every day. And I know not all cancers are curable, and I know some are more than others. I'm not actually that familiar with testicular cancer. I'm learning today with you. So is testicular cancer one of those that we can treat and patients do likely overcome? I'm just curious. For testicular prostate.
So testicular cancer is, the reason it's one of my favorite is patients, the group of patients who gets it are young and they healthy. They have their whole life ahead of them. 30, 40 years ago, they used to die. Nothing could have happened to them. And now, even the most metastatic, like I've seen patients who had brain mets, massive lung mets. They had more mets in the lungs than the lung tissue. And these patients get not only treated, but they are cured from testicular cancer. And the cure rate is between 95% and 99%. And that's including metastatic disease. So testicular cancer is highly curable disease. Prostate cancer is very curable disease. And even the ones that are not curable are very treatable as well. And we usually can manage metastatic prostate cancer with multiple treatment options, including hormone deprivation therapy, chemotherapy, immunotherapy, and they can live their life with minimal side effects from treatment and live decades and could live and die from something else. So prostate cancer is very curable and it's very treatable as well, if not curable.
That's amazing. That's so good to hear. I love to hear that because unfortunately it's not always the case.
Yeah, and my question was going to be if you have a message for men regarding prostate cancer, especially in light of today's announcement by Al Roker, who happens to be African American, highest risk group, and happens to be 66 years old, which according to the American Cancer Society is the average age of diagnosis of prostate cancer. So it's amazing coincidence, but is that the main message you want for men to know regarding? And a lot of them don't. No man is happy about the exam, the physical exam, and a lot of men put off their checkups anyway. So what's the big message for regarding prostate cancer that you would tell men?
The message is once a year, especially if you're a high-risk group. It's very simple, a PSA test and a simple exam. That's all you need. And if you get diagnosed with prostate cancer, it's not the end of the world. It's a very curable disease. With the current treatments we have, the side effects from treatments are minimal, and patients recovered extremely well and gain back. Now we don't even talk much about the cancer part of it. We talk about the quality of life part of it, the sexual function, the continence. Almost I have not seen a patient with incontinence from treatment to prostate cancer in a long time because the outcomes are very good. Now we focus on the quality of life. So if you happen to be diagnosed with prostate cancer, it's definitely not the end of the world, and you still have so many years to live and to live a full life, not just exist. So that's my message to prostate cancer patients.
Great. Thank you very much. Excellent. Excellent.
This was amazing. Thank you so much, Dr. I'm going to say it right. Don't tell me. Hold on. Dr. Al-Dafraoui.
Yes, you got it perfectly right.
Oh, right.
Al-Dafraoui, okay. I know what it is for people to get your name wrong all the time. My name is pretty unique, so people get it wrong all the time. So don't worry. I understand.
It doesn't bother me at all. Not at all. But you get it perfectly right. So
good. And then I just realized my name is not showing on the screen, so I'm gonna type it for you. Hold on. So there it is. You see it? Okay.
Yeah, I see it.
All right. So it was so nice to meet you. We really greatly appreciate your time. As I mentioned, we really appreciate it. What we're going to do with this information is take it and package it in various ways to see how we can put it together for possibly blog content and or get interest from the media. Nothing is guaranteed. That's why we call it earned media, because we just try to get their attention. But if any opportunities do arise to feature you as the expert in any content or media, I will definitely let you know, and we will have a blog piece about testicular cancer. So that one I will send your way for approval as well. So we'll be in touch soon.
Sounds great.
Thank you, Doctor. Appreciate it.
All right. Thank you very much for your time.
Take care.
Yes, it's been nice to meet you.
Take care.
Bye, guys. Thank you.
Bye-bye.